time again, right? It's going to be a team that's going to be taking care of you. That's
Yep.
particularly true in emergency medicine, right? I often will tell families, they're like, oh, if we have a really good interaction, they're like, I'm going to see you again. I'm like, if you're lucky, you will never see me again in your life.
It's been a
But
good day. If
yeah, but allowing families to have control of their information and their data, so that they can actually, you know, trend when they see a different provider, they can say, hey, these are what my labs were before. These are my chronic medical problems. I think that level of transparency, I mean, comes with a lot of lift and concerns about privacy and things like that. But when it's done right, when patients, have a role in the ability to kind of see what's going on in their care, to peek behind the curtain a little bit,
yep.
I think ideally forms or forges that therapeutic alliance a lot stronger.
Do you think that having that technology potentially like in your hand on your iPhone has influenced that at all?
Absolutely, right? I mean, everyone knows about Dr. Google, and uh,
Absolutely. They go to Dr. Google to ask for help.
yeah, they do. But I think what the again, when we talk about like the pendulum swinging, right? I think that the amount of people who I think who understand that Google has its limitations, and that we have these tools now to also let patients kind of see and do research, and you know what I mean, and see the way that we think, when they're able to read their medical records, when they're able to see their labs, and or their X-ray reports. I think that again, it um, it's patients and families have a higher expectation of what they uh, are going to receive during a visit, but then also, I think, have the ability to have more informed care as well. And so the process was innovative, was emergency medicine. I mean, just side note, one of the things I love about emergency medicine is our ability to grow, adapt. You know what I mean? A lot of the emergency department is really all of healthcare in a little crucible, and it's its own little health system. And so it's a great lab for research. It's a great lab for development, for testing ideas, for piloting ideas. And so scribing is one of those things, right? But communicating to them, being able to communicate to them that this is the next step. This, and maybe even being clear about your ED team has done everything that they can. They've done their work. We're just waiting for someone else for the next step. Might help allay some of the frustration that families feel, the frustration that is taken out on our staff, right? Is meaning that which I think can affects our staff's level of job satisfaction, their wellness, the rates of burnout. And so again, I think that transparency can be empowering, and then automating those steps in communication, so that when a patient finally get to ask a question, the question is not what's my next step. It's we've already covered that, right? Is that we can focus on the medicine as opposed to focusing on the minutes.